Today marks exactly 2 years since the first COVID-19 case was detected in South Africa. The patient was a 38-year-old male who had travelled to Italy with his wife. Amid growing calls to end the state of disaster, Health Minister Dr. Phaahla says his department has been working to come up with new regulations to replace the state of disaster. He says the department is now ready to present its proposals to the Cabinet and the National Coronavirus Command Council. There have been calls for the state of disaster, of course, to be ended. But let's speak to Dr. Sibongiseni Dhlomo, who's the Deputy Health Minister. Thank you so much, Deputy Minister. It's been 2 years since the first case of COVID-19 was first detected in South Africa. Let's just reflect, as we still find ourselves in the midst of this pandemic. Let's reflect on the highs and the lows, when you look at South Africa's fight against the pandemic.
Mazwane, I hope you can hear me well. I cannot improve my network better than this.
I can.
Good evening.
I can.
Thank you very
Are you
much.
able to hear me?
I hear you well. Thank you very much.
Thank you.
Yeah, I would like to start by raising our thanks to our healthcare workers for their availability and support in this pandemic that we faced. And also, Mazwane, immediately say to your viewers, we still have vaccines, by the way, that are available. Though we have used 31 million doses to date and have vaccinated 48% of the adult population. Yes, that is still far much better than what is happening in Africa, where they are less than 10%. But this week, our Minister Phaahla met with other ministers in the world, Minister of Italy and Minister of Norway. Those countries have vaccinated over 90% of their population. That is what we see in those countries. Yes, Mazwan, we have survived 4 waves as a country, me and you and many more who are still around, but we have lost so many, over 91,000 of our people in the country have really gone through. Surviving through those waves has been through learning from our scientists who are saying to us, Mazwane, let us continue to vaccinate, because now there is enough information that if you are vaccinated, you really can do a very big impact on this COVID-19. Just yesterday, when the minister had a media briefing, we learned that we still have patients in hospitals. 72% of persons who are admitted on COVID-19 related infections are unvaccinated, 72%. Of course, we are great that not only 10% are in the ICU, meaning that this wave has not been like the previous wave. So we are saying, Mazwane, yes, COVID-19 still kills. And our hope is therefore we need to push these vaccinations percentage from 48 very close to 70%. And that is really what we are pleading with our South Africans. And you are right, Minister.
Pardon me, Dinangwe, as we talk about what I suspect you are going to go to, which are these new regulations. Of course, these are happening against, the growing calls for South Africa to end the state of disaster. I mean, we saw there was to be a march today at Orlando Stadium as the derby is playing, with soccer fans crying to really be allowed to go back into the stadium and support the game. I wonder, some of these regulations that are going to be tabled before the National Coronavirus Command Council from the Department of Health to replace the state of disaster, are you able to share some of those with us?
Mazwane, how can I do that when the minister has not briefed even the president? Because it is after briefing the president, cabinet, then we would actually be able to take their guide and advice. As health, we're just facilitating the process and report based on the scientific reports we get from our scientists. It is still the cabinet, the NCCC, also the cabinet that will make a final determination of this. But Mazwane, I must actually hasten to say, the countries that are opening up stadia, the countries that are opening up entertainment everywhere, which is what we are pushing that must happen in our country, are countries that have vaccinated over 70% of their population, because there's less danger if you put thousands and thousands of people, at least if they are all vaccinated. Now, the Deputy President has gone around the country on this Return to Play program, supporting the Minister of Sports, Arts and Culture, Minister Mthethwa, and we need to really make sure that we follow those processes. But I can tell you, Minister Phaahla is going to table regulations that will actually make the cabinet to be actually take into cognizance all these reports and maybe decide to say, South Africans, this is the carrot, but the carrot comes with the stick. That I probably won't pronounce now, but that is something that you need to go that way. You can't have your cake, Mazwane, eat it and still have it. Now, we wish, if we are for vaccinations, it's because we are learning from the world and scientists that vaccinations is the only solution to making people go around there. That is actually what we see in the children that are vaccinated, and we are really seeing the students in the high schools and universities are vaccinating, and that is pleasing to us. We are still pleading with many more South Africans to take up this one weapon that we have of vaccination in the country.
And Dinangwe, you talk about, the young people. When we listened to the minister yesterday, patients are getting younger as well in South Africa. Infections between ages of 10 and 14 years. Is this a growing trend that the department is worried about?
We are definitely. Though, Mazwane, we believe that if you check on the wave, it was around the school opening, traveling of students and parents from Limpopo, Gauteng to KZN, and all that came around that time. So we are actually saying, even if we are actually getting that heightened infection, we would still be happy if our South Africans are vaccinated, especially the elderly. You see, the elderly must be 50 up to 70 years old, they are vaccinated up to 60% or more. In fact, the 60 years and above are vaccinated 70%, which is very great. But the 18 years to 34 years, where Mazwane belongs, that age group is really struggling. We are sitting at the 34%. And that's a population of South Africans who are going to be excited about opening stadia, going to theaters, going to every place of entertainment. So that is the population we are really keen to see them taking up the vaccines, because they are the ones who benefit much earlier and better than my grandmother for a stadium being opened. That's what we need to say. Please come on board. We want to open the stadium, but we need also to make responsible decisions. We are very happy that me and Dr. Phaahla at the back seat now, we have allowed our young health professionals to lead Key Ready campaign, saying, please, I'm ready to go back to the stadium. I'm ready to do this, Minister. Open up, can I vaccinate? And we say, maybe let us take a back seat and say, support this call of Key Ready. I am ready to vaccinate, therefore I can open up the stadium.
And while we're still on that, where do you think the message is falling short to persuade these younger people to be able to vaccinate? Because I was really going to touch on that Get Ready campaign to find out how things are going, because as you say, the concern is around the younger people who are choosing not to vaccinate. Where is the message falling short here?
We think it's multi-pronged. I might not know all the reasons, but my grandmother is less likely to listen to, she probably doesn't even have a WhatsApp, and listening to many messages that are conflicting with some of our desired messages that we put on board here. I'm actually pleading with South Africans, why don't you give a benefit of doubt to listen to the scientists and what they are guiding us on? Then the messages that are coming out there on social media, untested, some of them are against this process. So we think, because my grandmother is not as exposed like me and you to internet and to all those things, they listen to a voice of saying, let's vaccinate. So the younger people have got a lot of influence of the social media, and some of them, they've been believing that this disease is probably not for them, it's for the older people. Because when we started, yes, we saw many older people dying. It is true that the the higher you go on the age, I mean, the elderly ones are more at high risk. But now we have seen that that is not the only criteria now. Also with some other diseases, but even the younger people now are getting affected. So we want to plead with them to say, this is not the disease of the elderly. This is not the disease of the people who are sick. It is all of us to vaccinate. But we could want to swell our vaccination campaigns. And number two, we are taking the vaccines closer to our people, to the shopping malls, to pop-up centers, to taxi ranks, everywhere. So we have decided to say, let's take the vaccines to where people are, where people walk around in the malls. But we still find that there's a low uptake from our younger people, and we are only pleading. I may not know all the reasons, Mazwane, as to why we are getting this low, but those are some of the ones that, younger vaccine is likely to not make me have babies when I'm older. No, there's not something like that. Scientifically, we don't have such evidence, and therefore we'd like to say to the young people, please don't listen to those messages. We cannot give you a vaccine and know that it's going to cause you infertility. No, it doesn't.
All right, Dinangwa, thank you so much for pushing through. I know at times the line was not so great, but thank you. The message has been put across. Thank you so much for your time. That was Deputy Health Minister Dr. Sibongiseni Dhlomo.